Most vets think running is going to wreck their knees, so they stop, right? However, the data in my experience shows the opposite. Today, I'm going to show the exact plan how I use to help veterans get back to running without worrying about their knees being shot or wrecking their knees. And without jumping straight to knee surgery. So, I'm Dr. Ray Peralta, physical therapist, a Marine veteran, and run coach. And over the past 10 years, I've helped hundreds of people, including veterans, avoid knee surgery and get back to running pain-free. Clients in their 60s and beyond have returned to 3-mile runs and steep hikes and rucks. By the end, you'll have a step-by-step plan to cut that knee pain, rebuild your strength, and safely return to running without relying on surgery, first thinking, or having to rely on like injections or like costly PRP treatments. So I'm going to cover a couple of things. One, mindset and myths. Two, progressive strength and return to run plan. And three, lifestyle levers that accelerate the recovery. So you're going to get clear steps, benchmarks, and safety rules so that you can start implementing it today. So number one, mindset reset, right? So your brain is going to be your first rehab tool. So we have to start reprogramming some negative thoughts and beliefs, right? Because if you believe that you're broken, that you're disabled, that you're never going to be able to move or lift or run or ruck or whatever because your knees are shot, guess what? You're going to start behaving in that way, and then it's going to become a self-fulfilling prophecy, right? So one, you have to understand that running, the sport of running alone, isn't inherently dangerous, right? So yes, it can be high impact forces on the joints. However, you don't have to quit running altogether. And running doesn't necessarily equal destruction to your knees, right? This is like a fear-driven, beliefs that it's going to delay your healing. One, because you're not going to take action to start improving yourself or, start doing what you have to do to make your knees healthy. And in fact, when you actually look at long-term research, only about 3% of recreational runners actually develop arthritis in their knees compared to sedentary, only 10% of sedentary people or couch potatoes who don't do any exercise. They actually have a higher risk of arthritis than the people who are, take up running as a hobby, a recreational runner, right? So sitting on a couch in some ways is actually more risky than not going for a run on the long-term basis. They actually have higher rates of arthritis. So pain doesn't always equal tissue damage. That's another thing. A lot of times people think that pain means they have to stop altogether. It's they're wrecking their knees, they're destroying their knees. The thing is that pain doesn't always equal tissue damage. About half of pain-free people show degenerative changes on their imaging, on their MRI or their X-ray. So don't let scans dictate your future, right? Because again, you could go to a different radiologist and get these imaging reports to say, hey, you got this knee arthritis, right? However, that knee arthritis, it doesn't mean that it's the cause of your pain. It doesn't necessarily also indicate that you have to stop doing activities, right? So first step, right? Replace that belief that your knees are shot or your knees are done with, hey, my knees just need to get stronger, right? They just need to be able to tolerate load. They need to build up a load tolerance, right? You just need to rebuild your knee. You can rebuild your strength. Even in your 40s, 50s, and 60s, you can actually rebuild knee strength, the cartilage, the tissue around it, the muscles, the tendons, etc. Step two, use a traffic light guide to guide your training, right? So a lot of times I teach my clients, my patients, the pain traffic light guide. Green light, yellow light, red light. So green light is safe to move. So it's like pain, that's 3 out of 10 or less. Either no pain or very mild pain. That sure, you may feel some ache or discomfort, but it typically goes away within the first 10 or 15 minutes after stopping your run or your lift or whatever activity you're doing. It goes away fairly quickly. It's maybe a pain that kind of comes, but then it kind of goes away. You warm up, etc., and then it eases. Yellow light is pain that's like 4 to 6 out of 10 pain in the pain 0 to 10 scale. This is like moderate pain that happens. Maybe it persists for a few hours, even up to a day, but then it goes away. This tells us, hey, we just need to modify the training. Maybe you went out too fast, maybe too far, or maybe started lifting too heavy. You just got to scale back the training, maybe decrease the volume, decrease the intensity. And oftentimes you can continue training. You just have to decrease the training load and you continue to work around it. And then a red light, this is where we have to stop the activity that was aggravating it. So this is going to be severe pain. That's like a 7 out of 10 or more. And that lasts for more than a day or two, like actually goes up to 3 days or even longer, right? If it's really severe, you actually have to consult with a medical professional, go to orthopedist or physical therapist, etc. This is the type of thing, hey, we may have to take a break from, let's say it was running. So you may actually have to stop running for a month or so to allow the tissue to heal. And obviously work with a healthcare professional. If you're limping around even with walking, like you have severe pain, it's lasting more than 3 days. So step three, and track your beliefs, right? Your thoughts and emotions, beliefs around your injury and your pain. Obviously, you could track your pain scale, but also your function, how you're moving around. Because sometimes we get stuck in the pain cycle, but we're not looking at movement, right? You have to also see how your body's moving. Can you squat? Can you go up and down stairs, right? Look at also movement and function, right? And not just focusing on the pain alone, also look at function. So I've helped various people. Even myself, I've actually dealt with back pain after I left the Marine Corps. I had back pain and knee pain. And that knee pain was so bad sometimes I couldn't even keep up with my girlfriend just for a walk, like after a mile. So I was limping. I had to stop and slow down. I felt embarrassed. Like I could barely walk because it's knee pain. And the thing that helped me was to understand that, sure, the doctor said I had like a meniscus tear in my knee, but didn't mean I have to stop training my knee, right? I was almost afraid of training the knee. And the way that knee got better, I started rebuilding it, doing squats, step downs, over time, regaining the strength in different ranges of motion of the knee, going a little bit deeper, adding some weight to it, and increasing my walking, even though the walking kind of hurt, still trying to increase my steps. And I was also a bit overweight. So, and we'll talk about that a little bit later in the lifestyle portion of this. But making these changes, I was able to get rid of the knee pain and eventually run a marathon. So things are possible. Just because you have like some arthritis or a meniscus tear doesn't mean you have to quit running or doing sports altogether. So strength is going to be your superpower, right? So you have to build the engine that absorbs load. Even in the knee, you could actually build up knee joint strength. A lot of times people think of strength in just in the muscle, but you could also build up joint strength. See, people don't get frail from age. They get frail from inactivity. So a lot of times people think, oh, I'm just getting older. That's why I'm getting weaker, right? But the thing is, a lot of people are getting deconditioned because they're just not moving as much, right? They oftentimes they have desk jobs, sedentary jobs. I know a lot of veterans take up some kind of office job, or maybe they retired and now they're just kind of sitting around all day. So you just have to move more, increase your movement. And then strength training is crucial, right? And the right strength training. You just can't do the same workout without progressing, right? Strength training can help rebuild low tolerance, especially in the knee joint, can improve your mechanics when done with proper form, and can boost your confidence. All right. So to start, taking up strength training, especially if you're brand new to it, or maybe you're returning it after years of a break or a layoff, you want to prep, all right? Maybe you start with some basic exercise like body weight movements. Maybe you do some quad sets, some leg raises, some assisted squats. You may even have to hold on to your kitchen sink and do assisted squats at the sink. And then, then get on hands and knees and do some hip strengthening, hip lifts or leg lifts to the side, hip abduction. So you want to strengthen your glutes because the glutes also help control your knee. Strong glutes is going to be very important for that as well. And then you also want to train below the knee. So, calf raises, tib ant raises. So training the calf and the tibialis anteriors, also very important. And then you could train your core as well, planks, front planks, side planks. And then, once you get past the body weight, you could keep doing body weight, by the way. So if all you have access to, you just keep making the body weight challenging. But you could also start incorporating weights, free weights and bands. So you could do from squats to split squats or lunges with kettlebells or dumbbells, right? Maybe start with like 5% of your body weight or 10%, and then start going up until you're lifting your own body weight, and then even start going above your body weight, maybe going to 1.5 times or even 2 times your body weight with the squats or the lunges, right? It's not going to happen overnight though. So you might start again, like just 5% of your body weight and then start ramping up with the weights. Keep track of it, right? Every week or two, see if you get like 5% better. Sometimes it's even 1% better, but that's still going to add up over the course of a year or 2 years. Other exercises you do, step downs, Romanian deadlifts. You can also do machines. If you only have a gym that has access to machines, fine, use the machine. Use the leg extension machine, leg press machine, leg curl machine, right? Do seated and standing calf raises. All these things can be beneficial to help you get stronger and, keep you long term in the game, right? So as you get older, you can continue to run or lift or ruck. And then if you also want to get into running and you haven't, it's been a long time since you haven't run, make sure you have a strength base. I tell people have a strength training base first. So you have strong legs, and then you can start training both concurrently, but don't jump right into straight running or straight away running, right? Do walk run. So a walk run program I recommend, maybe you start with like 30-second run, 30-second walk. Do that for 10 minutes, then build up to 15 minutes, and then 30 minutes, and so forth, right? Depending on your goals. Like some people just want to do 5Ks. That's fine. Usually your workouts could be like 30 minutes. But if you want to train for like a 10K or a half marathon, you're now going to start doing like hour-long run-walk workouts, or then 90 minutes run-walk workouts. And there's different variations, right? You could do like run for a mile and then walk for a minute. There's different variations of run walk. Don't think it just has to be 30 seconds on, 30 seconds off. And also, folks who've had surgery in their knees or are considering getting a surgery, oftentimes one, you could avoid a second surgery or avoid surgery altogether with smart strength training, right? Surgery can be indicated. I'm not saying avoid surgery altogether if you have like a traumatic injury or you just absolutely need surgery and you gave an honest effort to proper rehab, strengthening, rebuilding your knees, but it should be the last resort, not step one, right? So I actually helped a veteran who was actually wheelchair bound, and this guy's older too. He was like 70 years old, wheelchair bound, and he had surgery, he had like knee surgery, and he thought he was just going to have to be wheelchair bound. No, I actually got him up and moving. And sure, he was only walking at first just a minute or two. First, it was a few seconds. And then he progressed like 2-minute walks back to his wheelchair. And eventually walking 5, 10. And then eventually he was able to walk without the wheelchair altogether. It was, and still to this day, I think his story is like clear in my mind. I was like, whoa, this is impressive. He's a World War II vet. And incredible. It might have been Korean War, but regardless, he was a vet, 70 years plus years old, Army vet, and he got out of his wheelchair. It was incredible after this knee surgery, and just simple progressions. And we also strengthened his knee. We started with just body weight, leg extensions from his wheelchair, using ankle weights, resistance bands, and eventually he got up out of his chair. Then he was doing just standing squats, calf raises, and he was just committed. He just needed the right plan, and he executed it. So just understand that it doesn't have to be a life sentence. That just because you had like a knee arthritis or even a knee replacement surgery, or not, maybe you're in a wheelchair, you can build up strength. If you don't have like a neurological deficit or anything like that, just because maybe you just have weak muscles or tissues, you can rebuild it. So let's now move beyond the gym. So phase 3, right? So recovery is a lifestyle, not just a list of exercise. So another common thing that I see is that people think that, oh, I've been given stretch and strengthening exercise in the past. You don't understand it. I've tried. I got some relief, but not complete relief. So oftentimes those people, I say, hey, they just got an incomplete recovery. And the thing is that they're still not moving enough, right? So yeah, sure, maybe they'll stretch a few times. Maybe they'll stretch every now and then, maybe 3-5 times a week they'll stretch, maybe a few times a week they'll strengthen, but it's still sporadic movement. You still need daily movement. That's going to beat a sporadic, max effort days, right? You also need to sleep, stretch, have good nutrition, a good protein intake to help drive healing. Well, tissue healing actually heals with these combination of things. It's just not the exercise alone. Sometimes people just focus on the exercise and ignore the lifestyle factors, right? The sleep, the nutrition, stress management, right? So what are going to be the steps? Like, okay, what do I exactly do? So daily, try to walk, 6K steps a day. Go build that up to 10K steps if you could tolerate, right? Every day you should be moving, right? If you work a desk job, get out of your chair every hour. Or if you're standing, you're working like a retail job or a job where you're standing all the time. Just take a break from standing and move around, stretch your legs, stretch your knees, maybe do some gentle squatting, gentle knee stretching, right? Some gentle daily mobility, right? It can't just be sporadic stretching that you do a few times throughout the week. That mobility has to be daily, right? And then oftentimes it's like a morning and an evening session, especially if your knees are very stiff. You may have to have like 2 or 3, stretch snacks, I call them, right? 3 to 5 minutes of stretching for your knee in the morning, afternoon, evening. Sure, it sounds like a lot, but at the end of the day, it's only like 15 minutes of mobility work, which 15 minutes is like about 1% of your day, right? So, and the stretches can vary. So people are going to have different stiff areas. From the most common stretch for the knee is often knee extension, having to extend the knee to restore knee extension. But sometimes people are more limited in flexion, so they have to bend their knee to restore knee flexion mobility. So when knee flexion is like heel to butt, it looks like the standing quad stretch, but but oftentimes people underdose it, right? They only do like 30 seconds. No, you have to build up to like 3 minutes, right? So, 3 sets of a minute hold, and then, or even 3 to 5 minutes. So sometimes you have to go up to 5 minutes again. And it has to be frequently, or at least a morning and evening session. And then sleep, right? So many times people are sleep deprived, like, oh, I get partial recovery with the exercise, but I'm not getting full recovery because you're not sleeping enough, right? So, sleep at least 7 hours a night. Yes, I understand there's some people who are outliers. There's some jockos out here who you're like, oh, I'm like, I could sleep just 4 hours or 6 hours. Sure, there are some genetic outliers, But for the most part, 7 hours a night is what you need to allow the body to recover. Some people may need 8 hours or 9 hours, but at the minimum, like 7 hours. Nutrition, make sure you're eating enough foods, especially protein. Protein's like the building block, especially for tissue recovery and repair. So aim for about 1 gram per pound of body weight. Now, if that's too much for you, you can start a little smaller. You can start like a 0.8 gram per pound body weight, or even 0.65 gram per pound of body weight, right? But regardless, you're gonna need enough protein to help your body rebuild and recover, especially to take some of the strength work you're doing to actually start rebuilding muscle. Especially as you get older, you start losing muscle mass. Also, make sure you're properly hydrating, keep the tissues nice and lubricated. And if needed, if you're overweight, reduce your weight, right? If you're overweight or obese, right, just a 5% reduction in your weight can help reduce stress on your knee joint, reduce load. And then, stack these habits, right? Pair your mobility with your morning coffee or after your lunch or your dinner, right? Do an evening walk as like a kind of shut down or cool down for the end of your day, right? Because so many times people are just not getting enough movement. So, hey, schedule a walk after your lunch or a walk after your dinner time, right? It doesn't have to be long. It'd be like a 15-minute walk twice a day. You'll get 30 minutes of walking a day. So I've used these simple habits myself when I was recovering from my own like chronic persistent knee pain, because I thought, oh, I would get temporary relief. Why am I not getting fully better? It's just because, again, even though I knew technically what to do, I just wasn't implementing it, right? So, but once I got really disciplined, following the walking, getting enough sleep, hitting my protein targets, it sped up I finally got the complete recovery I was after by integrating this lifestyle medicine, lifestyle habits approach. So to recap, right? One, you want to reprogram beliefs, especially if you have negative beliefs about your body, your knees, abilities. Understand that pain doesn't always equal tissue damage, and motion is lotion. Get strong and progressive, right? So even though you may have strength trained in the past, you can't just keep repeating the same strength workout. You need to progressively get stronger, right? You can try to aim, even if it's like 1% stronger than you were last week. You still want to try to add a little bit more reps, more load, more weight, right? You also need to train your legs. You also need to train them not just once a week, at least 2 times a week, but sometimes it's even 3 times a week. But you do need to train them, and the major muscle groups should be trained at least 2 times a week, again, sometimes more. And for the legs, we're talking quads, glutes, hamstrings, calves. And also rethink surgery. If you're considering surgery, do rehab first, but do proper rehab, because not every rehab is the same. If you've tried rehab in the past and you're like, man, I need someone who kind of gets what veterans going through, especially veterans want to get into running or just being active, work with someone like myself. I'm a physical therapist. I'm also a veteran, and I understand that, hey, you just don't want to be able to do the basic stuff. You want to take it to a higher level, right? You want to be able to run, jump, squat, etc. So I work with people also online, and I'll share how to do that. But you could reach out to me and live your recovery process, right? Don't just focus on just doing the exercise alone, but outside the exercise, outside the gym, making sure, hey, you're walking daily, you're getting enough sleep, you're eating enough protein, right? You're keeping your stress under control, right? Decreasing the tension around your joints. So if you're interested in working with me, I do have a free course about my Skool community. So it's for being pain-free. Originally it's for runners, but I also work with veterans as well. So check it out. I have free resources on there, the free course. There's a link in the description. And if you're also looking for one-to-one help, I'm also running a 28-day Operation Pain-Free, where I'm helping people get rapid pain relief. Depending on the type of the pain or the injury, of course, I'll have to do an assessment. But regardless, most of the people I work with can get relief in as little as 28 days. This is where I'm going to help you get pain relief, rebuild strength, whether it's knee pain, back pain, or some other type of orthopedic or sport-related injury, help restore your range, and return to whether you want to run, what you want to lift, or you just want to be overall kind of healthy and be able to, participate in whatever sports you want to do with a proven plan. So you could join the link in my Skool community, DM me the word OPF for Operation Pain Free, or also find me on Instagram, and you can send me a direct message on Instagram, OPF. Anyways, I'm out.